Over time, we would expect a diastasis to naturally come back together, but that can go back to that original picture of your deep core. Do you have good function? Do you have good posture? Do you have good breathing mechanics? Do you have outward pressure against your tummy every time you're breathing? Do you sit like this, where you have all the time, you have pressure out on your abdomen? So many different things that can come into play. We're not going to talk about intra-abdominal pressure today, but that will be for some of those women who are sitting there thinking, oh, I have a diastasis, but how do I fix it? We'll get there as we go through the process, okay? But taking a little look back at the C-section versus vaginal delivery, obviously with the vaginal delivery, there again it's called natural delivery. How lovely. So natural for a baby to come out of your small little vagina. But the baby's obviously passing through the pelvic floor musculature. So most of the, I don't like to use the word damage, but most of the damage or trauma to the body has occurred through the pelvic floor. Then with the cesarean section, and some of these women might have spent time trying to push a baby out and then been taken for an emergency C-section, so they might have still had some degree of trauma to the pelvic floor musculature through that. You can also have trauma to the pelvic floor musculature just from pregnancy because of the weight of your baby, and then again going back to, well, how did you breathe and how did you exercise and what did you do through your pregnancy to look after your pelvic floor health. But just going back to the generalization that if the baby comes out your vagina, generally it's your vagina and your pelvic floor musculature that has received more of the trauma. If the baby has been taken out via cesarean section, then obviously that's a significant surgery which has happened through the abdomen. So what is it that they cut through? It's a big misconception, is the word I'm looking for, that they cut through your abdominal wall when they take the baby out. That's not true. They're just stretching your abdominal muscles to the side to get baby out. They do obviously cut through the uterus, which is a big muscle, but then a lot of these other layers are connective tissue, fat, etc. to get to the baby, but not the muscle wall that you think has been cut itself. However, that doesn't mean that just because the muscle wall has not been cut through, that it doesn't receive trauma. It's been stretched quite considerably out of the way with force, and when the layers are individually repaired at the end of the surgery, as they heal, you can get scar tissue formation between each of those layers. Some layers might have more scar tissue than others. And then remember that white stuff that we had a look at with the other picture, or the fascia, which is between each muscle, around it, through it, it's everywhere. We can get what's called adhesions throughout those, throughout the fascia. And it could be that it's a little ball of fascia which has tightened up inside a muscle. It could be anywhere through the abdomen, really. And then because everything is connected, it can send referred pain. It can then cause another adhesion in a different area. And then you can have these little adhesions form throughout the body. I mean, you can get them anyway, even if you haven't had a cesarean, if just from pregnancy and the stretching. But typically with cesarean section, obviously you're more at risk for having adhesions and scar tissue formation within the abdomen, because that's the area that you've received the surgery. So what can you do to stop the over build-up of the scar tissue? What can you do to release some of the adhesions and even prevent some of the adhesions from happening? A lot of cesarean section scars, if they're often thought of to be pulled too tight, and women can be left with what we call an overhang, which is that layer of tissue which hangs over the scar. Sometimes there's nothing that you can do to fix that, and sometimes there's nothing that you can do to prevent it from happening. It might happen despite having massaged your scar, but we do know that if you massage your cesarean section scar, as well as your perineal scar if you have one of those from a vaginal delivery, that we're going to reduce the amount of scar tissue formation, and we're going to help the body break up those tissues. We also might help release any adhesions and then also prevent any of those from happening, because we want each of those layers of tissues to be able to slide and glide between the layers. That's what it's meant to do. When we have an adhesion between some of those layers might get stuck, and particularly in one area, they might not move. They're supposed to slide and glide and move around, especially when you're contracting all of those different layers of muscles. If you have an adhesion between two of those layers and some of those muscles are stuck in like glue in a certain area, you can think when you're trying to contract and compact all of those muscles together as one, that there's going to be an issue there. So scar tissue massage can be done relatively early on. You'd want to wait maybe a couple of weeks and get a clear go ahead from your surgeon or your midwife before you start to do it, and you'd start from further out and work your way in. So I'm going to pretend that I've had a cesarean. Obviously it would be lower, but I'm not going to pull my pants all the way down for you. so I've given myself a little horizontal line there. If you're super early on and there's pain throughout the scar, if there's any bleeding, if there's an infection, you wouldn't massage it, obviously, and you wouldn't be able to get the clear go-ahead from your midwife or your surgeon to do it anyway, I would assume. But once you do, you can start from further out, and then as you go through your healing process, or just say you're 1 to 2 years post already, you could sort of go right in straight away. But if you're early on, you'd start further out, and you start by doing lots of little circular motions. You can go up and down, you can go side to side, but circular is good because it's obviously getting each of those directions. And then as you get closer to the scar, if you feel pain or tenderness, then that would be where you would stop. You also don't want to push too hard, right? Gentle pressure, and then you can build the pressure up over time. You can also get closer to the scar over time until you can actually go right on top of it and release right on top of the scar. Another technique is to pick up your tissues, grab them, move them in different directions. So you want to pick them away from the body, move them up and down, and that's just going to help release any of those adhesions and promote those tissues to move and glide between the layers a little bit more. Obviously I'm being quite rough, so this would be someone who was further on and didn't have any pain, but if you were early on, you'd be super gentle and you'd watch out for any signs of infection, bleeding, pain, etc., and use that as a guide. That is us for today. I hope this has helped you in some way, and if the takeaway from today is anything, those with C-sections, try to massage your scar. But for everyone else, when you're thinking of the muscles of the core, especially for future videos, this is our core canister. So these are our deep core muscles. So when you're training your core, this is what we want to have the utmost, what's the word? You know, this is the most important thing. Our deep core canister is where it's at. So our breath is in control with this, and our next video will probably be on either how to breathe or intra-abdominal pressure, maybe both, which will be a big one. But we need to keep visualizing this core canister. So you have your pelvic floor sling at the bottom from last week's video, and then we have this here. If you haven't seen the how to Kegel video, that's on my page. You could go and look through that. Otherwise, I will see you next week for another video.